This program is for informational purposes only and should not be used as a substitute for individual medical attention. Always consult a qualified healthcare professional before undergoing any medical treatment.
A little girl card for your one little granddaughter. Grandma, I know why I'm so lucky to have someone like you.
Mrs. Clark's skin is in great shape these days. She's happier and more comfortable that way.
Mrs. Clark, it's time to turn on your side for a little while.
Okay, come on, Mom.
One skin problem that can really sneak up on our patients and residents is pressure ulcers. So Mrs. Clark's caregivers are always on guard for them. They know how awful they can be. The good news is that we can prevent many pressure ulcers before they ever get started. Regulatory agencies are stressing this important prevention effort, and we all have a role to play, including nurses, nursing assistants, family members, and even the patient or resident when appropriate. In this program, you will learn what causes pressure ulcers and some important steps you can take to help prevent them.
Pressure ulcer prevention. What caring people need to know.
This is a pressure ulcer. A pressure ulcer is a place on the skin where the skin, or the tissue underneath, has started to die. Pressure ulcers can happen to people who tend to lie or sit in the same position for too long without moving. Here's what happens. In a chair or in bed, our body weight puts pressure on bony places like the heels, tailbone, buttocks, and hips. The pressure cuts off the blood supply to the skin and to the muscle and tissue underneath. Without blood, tissue will start to die, causing a sore or pressure ulcer. That's why it's so important that the people we're caring for change positions often before a pressure ulcer can get started. You may hear pressure ulcers called by other names such as bed sores, pressure sores, decubiti or decubitus ulcers, but they're all talking about the same thing. Pressure ulcers can cost tens of thousands of dollars to manage. They can be painful and upsetting to the patient. Some even become life-threatening. Watch.
It only takes a few hours for a pressure ulcer to get started, often appearing as a stubborn red area on the skin over a bony spot on the body.
May I have your attention, please? The baby shower will begin in the activity room at 2:30. The baby shower for Nicole Turner will begin in the activity room at 2:30.
Quick discovery by nurses, nursing assistants, or family members, followed by good care, can reverse early damage. Unfortunately, tissue breakdown caused by pressure can get a lot worse. The skin may become blistered or broken, eventually becoming an open wound. There may be foul-smelling drainage. Some ulcers tunnel under the skin, so the damage you see on the surface may be just the tip of the iceberg. Sometimes, pressure ulcers go so deep you may actually see the bone.
Some individuals are at greater risk of pressure ulcers than others. The danger is highest for people who don't move very well, like stroke victims, or people paralyzed because of injuries, or patients in surgery or intensive care. Many elderly people have trouble turning themselves in bed, especially if they are weakened by illness. The risk is even higher if they tend to slide or slump down in the bed or chair, or don't eat well, or can't control their bladder, or especially their bowel. People can be thin or overweight and still get a pressure ulcer. Every new admission to a hospital or nursing facility receives a head-to-toe skin inspection to find out if they're entering with a pre-existing pressure ulcer. The nurse or doctor also assesses how likely the individual is to develop new pressure ulcers, considering risk factors such as immobility, poor nutritional status, and the presence of incontinence. People found to have an increased risk for pressure ulcers get important extra attention from nurses and nursing assistants, such as scheduled frequent repositioning and routine skin checks. Why don't active people get pressure ulcers? It's because we move all the time without thinking about it, even while we're asleep. But what if a healthy individual did stay in the same position for several hours? Almost certainly, a pressure ulcer would start right here at this pressure point under the bone.
The body has many pressure points. On this one at the hip, look at how body weight concentrates at a single bony point, close to the skin, where there's not much padding in between. That's why body weight can pinch blood vessels shut under a pressure point. The skin turns white because pressure forces blood out of the tissue. Soon, these tiny cells may start to die. But watch what happens if the patient changes position in time. Fresh blood gets back in before a pressure ulcer starts.
See? The skin's white because pressure forces the blood out. When I let go, the blood goes back. No pressure ulcer. So, how long can people safely stay in one position? A rule of thumb is 2 hours, but always ask the nurse or doctor what's best for each individual. It depends on a patient's overall health, his ability to move and turn in bed, and whether a special mattress that redistributes pressure is in use. For example, this woman is alert, eats well, and she can move on her own. She may be at low risk for pressure ulcers. In bed, she may be able to stay in the same position longer than 2 hours without skin breakdown, which is helpful during the night. At up to 1 hour at a time in the chair. But this man has poor bowel control, and he tends not to move much on his own. He is at high risk for pressure ulcers. So at least every 2 hours, his caregivers turn him and check and clean his skin. High-risk individuals often have a written turning schedule. Always follow your facility's procedure for documenting scheduled position changes. Now you know the most important rule to help prevent pressure ulcers. Keep turning the individual. But that's not all we can do. To lower the risk even more, we can make sure that patients and residents eat well, have clean, dry skin, and don't slump or slide down in the bed or chair. Watch.
Why is good nutrition so important? The skin is the body's largest and heaviest organ. Strong, healthy skin requires a balanced diet, especially lots of protein. Clean, dry skin is stronger too. Wet skin is soft and swollen and weak. Even worse, urine, and especially stool, can burn the skin. In fact, bowel incontinence can lead to a 22-fold increase in pressure ulcers. If the skin gets wet or soiled from stool, clean it up and dry it right away. Apply a barrier cream approved by your facility to help protect the skin. Did you know that sitting up too high or sliding down in the bed or chair can cause dangerous invisible damage? It's called shear. Gravity pulls down on the skeleton and internal tissues, but friction holds the skin against the sheet. The result? A hidden shearing force under the skin in the lower back and buttock area that can stretch and tear tissue and little blood vessels. The deep tissue injury, caused by a brief period of shear, may not show up on the skin surface until hours or days later.
Mr. Wilson, your head is too high. You're sliding down the bed.
Well, I want to watch TV.
Why don't you sit up in the chair while I make your bed?
Okay.
Now, let's build on what we've learned. For the next few minutes, I'll show you 9 pressure ulcer prevention tips. Watch carefully and think about how you'll use these important tips with your patients and residents. Here's the first tip. Since the pull of gravity causes internal shear and tissue damage, keep the head of the bed at 30 degrees or less to reduce the force of shear. Here's another tip. While Mr. Wilson is in a chair, there's a lot of weight pushing straight down on this pressure point.
Hey, Dad, it's been 15 minutes. You need a position change.
So teach patients, residents, and their family members that a boost up like this every 15 minutes or so helps get the blood going again. If he slides down, stand him up for a moment to relieve shear and pressure, then reseat him. Limit time in the chair to 1 hour if he can't boost or reposition on his own. In bed, encourage simple movements like reaching for the telephone. Just a quick wiggle gives the skin a welcome moment of pressure relief between regular position changes. Special support surfaces for the bed and chair using air, water, gel, or foam help redistribute pressure away from bony places on the body. Why is this pad special? The foam is dense and at least 4 inches thick. This pad is thin and doesn't relieve pressure. Sheepskin doesn't relieve pressure either, although it can reduce friction against the skin. Remember, even with the most expensive, high-tech mattress systems, we still need to turn our patients and residents. Brush away crumbs and pull sheets tight to straighten out wrinkles, since they can irritate the skin. Don't drag patients across the bed sheets. See how that tugs the skin and scrapes the elbow? Remember, friction can damage skin, and that increases the risk for a pressure ulcer. Here's the right way. Protect the heels with a pillow or with bent knees. Watch the elbows and use a lift sheet with 2 people. That's better. Every day, check each patient's or resident's skin from head to toe. You're looking for the early signs of tissue breakdown.
Remember, it's normal for skin to be red just after pressure is removed, but within about 30 minutes, healthy tissue will fade back to normal skin color. Skin that stays red or feels warm or firm to the touch is a warning signal of possible tissue damage. If you notice signs of possible tissue breakdown on a patient or resident, take action. A pressure ulcer may have started. Keep pressure off the area and reposition frequently. Don't massage reddened skin over a bony area. And don't apply heat. These actions may do more harm than good to damaged tissue. Make sure the nurse in charge sees or knows about the trouble spot. To assess for a possible pressure ulcer, nurses look for persistent redness. Feel for skin that's warmer or cooler than the nearby skin. Press to see if the tissue is firm, boggy, or spongy. And ask the patient or resident if there's itching or pain in the area. For nurses, the blanching test is a quick assessment for tissue damage. Press reddened skin for a moment, then look. Healthy tissue turns white, and then red again. Try it now on your nail bed. See? It turns pale. It's called blanching. Reddened skin that blanches is still healthy and should recover on its own when pressure is removed. However, skin that doesn't turn white from a finger press means a stage 1 pressure ulcer may already have started. It's called non-blanchable erythema, a sign of early tissue breakdown. Persistent redness and the test for non-blanchable erythema may not show up as well on individuals with a dark skin tone as it does on those with a light skin tone. So, look for skin with a reddish, bluish, or purple color. Feel for skin that's warmer or cooler. Press the skin to see if it's firm or spongy, and ask if there's pain or itching in the area. Tell the nurse in charge about any questionable trouble spot you find.
Let's make sure you're not getting any pressure ulcers, Mr. Wilson. I'm going to check your skin for red areas.
Every day, such as at bath time, look for signs of beginning pressure ulcers. They're easy to miss, so check carefully from head to toe. Most pressure ulcers begin on pressure points, where the bone is close to the skin's surface, like the heels. About a third of pressure ulcers happen here. The ankles, especially the outside. Between the knees, on the hips, at the tailbone or sacral area. The sacrum is the most common site for pressure ulcers, especially those caused by shear. The buttocks,
or ischium,
a site easily injured from sitting too long. The elbows, a common site for friction damage. The shoulder blades,
the ears,
and the back of the head. To reduce friction damage, use elbow protectors, or long-sleeved pajamas, and thick socks. Pillows are a great way to take the weight off pressure points. Look how a pillow under the lower leg floats the heel's pressure point safely above the bed. Certain specialized heel protectors can safely float the heel too. Don't use protective rings like this to try to prevent pressure ulcers. They're called donuts, and while they may reduce pressure here, this skin gets squeezed so badly the blood supply may be cut off. Lying in a 90-degree side position is not a good idea. It puts too much weight squarely on the pressure point at the hips. This is better. The 30-degree tilt position. See how the pillows spread out weight?
Your skin's in great shape, Mr. Wilson.
Good.
Sometimes, in spite of all our efforts, pressure ulcers may still develop. But our actions as caregivers really can make a big difference. Simple, old-fashioned things like well-placed pillows, keeping the head of the bed low, frequent repositioning, and daily skin checks are just as important as the most expensive prevention technology. And when we inform family members about pressure ulcer prevention, they become a valuable resource too. We know prevention is worth the effort. The single pressure ulcer we avoid can save months of painful, tedious therapy and enormous expense. Just remember, pressure is the key. If turning is skipped for even one night, a pressure ulcer could get started. So, watch the clock and make regular position changes. Keep up good nutrition and keep the skin clean and dry. All this may feel like a duty, but it's really an act of caring.